In our morning rounds, new research that could slash the number of people getting stents or bypass surgery for coronary artery disease. A study looked at more than 5,000 people with blocked arteries but without severe symptoms like extreme pain or heart attack. It found that regularly taking medications along with lifestyle changes was just as effective as preventing heart attacks and premature deaths as the more invasive procedures. Those medications include statins, blood pressure drugs, and aspirin therapy. Our Dr. Tara Narula is a cardiologist at Northwell Health. Tara, good morning.
Good morning.
This kind of blows my mind, to be honest with you. Why is this new research so important?
This was really a blockbuster trial that was just presented at the American Heart Association meeting and really hotly anticipated by cardiologists. So there are millions of Americans who have angina, which is chest pain usually caused by a blocked coronary artery. Many of them go on to have a stress test, and that stress test will come back positive, showing ischemia or low blood flow to the heart muscle. And the question has really been, in those patients, what do we do? Do we just treat them with optimal medical therapy, things like statins and blood pressure medicines and lifestyle changes, or do we do optimal medical therapy and send them to the cath lab for potentially a stent procedure to open the artery or bypass surgery? And we really didn't know the answer. We had data from previous years that had suggested what this trial showed, which is that when you compared these two groups, there was no difference in terms of things like heart attack or death over the course of follow-up between the conservative group of medical therapy and the invasive group. What the invasive group did have in terms of a benefit was less angina, less symptoms, and improved quality of life. So when you talk about making patients feel better and live longer, this showed that they may not live longer with a stent or bypass surgery, but they will feel better potentially. Now, this trial only followed patients out on a median of 3.3 years. So we definitely need a longer-term follow-up to see what happens at 10 years and 15 years and 20 years. Do we get different data at that point?
You have 1.8 million people getting stents every year. Do you think this could decrease the number of those type of operations that we see?
I certainly think it's going to make cardiologists potentially take a step back, and also patients too, and ask the question, do I fit the criteria of this trial? And should I really be going on to get a stent or a catheterization or bypass surgery? And so it will make us question it. Now, there are certainly patients who still will get stents, those with unstable angina, where the chest pain's really getting worse and worse and more severe, or they've had a heart attack, or they have very severe disease in their arteries. But for those other patients, certainly those who have no symptoms, there really may be no benefit. And if you have mild symptoms, then it's going to be a shared decision-making strategy where you talk to your doctor and you say, am I optimized on my medical therapy, my statins, my blood pressure medicines, my lifestyle, or can I do better?
Yeah. All right. Dr. Tara Narula, thank you very much. We appreciate it.
All right. Thank you, doctor.